you went across the state? I mean, you went county by county, like commissioner meetings? Is that how you started it out?
Yes, ma'am. I didn't go across the entire state. I mean, I'm working, I live very rural. I just tried to keep scheduling and scheduling and scheduling. And, a lot of counties said no. A lot of times we just got zombie stares, but the whole point is to go into opposition territory. But when it came, I would say the greatest aspect, so that gave some groundswell to sort of what I am just so thankful for Dr. Tribble, what he did. He was the board member, he drove it. And I think, Providence put him in that spot, and he's so knowledgeable and he's a very awake and compassionate provider, and also not afraid to speak the truth, regardless of the consequences. And so the reason why we were successful there was it was board driven.
Yeah. So Dr. Tribble, tell us a little bit about the catalyst, or maybe how you and Laura kind of met up.
The catalyst was kind of discussing in another discussion at a previous meeting, discussing the CDC's recommendations on the measles outbreaks that were happening. And there was kind of a bit of a discussion regarding their desire to quarantine based on vaccination status. And I brought to the conversation, there's a real lack of trust in the CDC and their current guidelines right now, and in public health and healthcare in general. And that opened the door to the opportunity, saying, I think a big reason for that is the fact that these COVID vaccines were not what they were sold as, and that we continue to endorse them here at the Public Health. And in the last couple of years, there's been a lot of further data coming out, indicating that they're potentially more harm than good. And I offered to the board, hey, I'd like to bring that discussion to the agenda for our upcoming meeting. Let's discuss this, and let me have a presentation so I can kind of bring some of that data and evidence, so we can reevaluate these to kind of as a step to bring back some trust in our public health. And so that's how we got it on the agenda.